Hey, welcome back, everyone. Glad to see you guys all here. I want to wish everyone a very happy new year. For your loved ones, for you, I want you to have a safe and prosperous 2022. Now, I haven't been on in a while. I've been kind of laying low. Some of you know why, some of you may not understand why, but today, what I want to talk about is what do we do in the midst of a crisis? We're going into 2022. We're still having a crisis, still having things that we don't know where we're going. We don't know what we're doing. We don't know what to expect, right? So in the midst of a crisis, what do? We prepare and we plan. And I want to just bring up a few things for you that I think we've forgotten quite a bit about during this crisis and for decades, really. I mean, we've forgotten how to take care of ourselves. We've forgotten all the things that God and nature has given us to help us be strong and safe and healthy and happy. And I want to just remind you that we have tools in our toolbox that can do that for us. So I went back and looked at all of the herbs that we've been given from nature, all of the things that in my training of natural medicine, what can we use? And I just picked out a few good ones for you guys today that I think will really help you in fighting illness in general. Now, we've been fighting illness for centuries, and some have done well, some have not. But what have our go-tos been? Like when you were a kid, what did your mom give you when you were sick? Well, it was usually orange juice. It was broth with a lot of vegetables in it. She gave us lots of vitamin C in the form of fruits. And there are things that we can do today to do that same thing. Like rose hips tea, for instance, has a ton of vitamin C in it. We can drink broth or eat chicken soup. Rest, of course, is really important. And for decades, when we've been sick, we haven't rested. Our employers say, still come to work when you're sick. You got to push through. The kids need to go to school. The job needs to get done. The house needs to get clean. The kids need to go to soccer or baseball or whatever. And when we were sick, we would push through. And that's one thing that I think out of this whole experience that we've been dealing with the last 2 years, that we've gotten really smart about, and that's staying home when we're sick, taking care of ourselves, resting, being kind to ourselves, because we've stopped doing that over the last 30 years. Sweating is such a good thing. The Native Americans used to use a sweat lodge. Now we use a sauna. Sweating is so good for us. Even if we have a fever, why does our body produce a fever? The hotter the body gets, the easier we are at killing things. And so sweating with an illness can be really helpful. Now, there are some things you have to be careful with in a sauna. If you have high blood pressure, you can't do that. If you're pregnant, you can't do that. So please, the information that I'm giving you here is general information, and everyone needs to check and see if these things are safe for them to use. And I would recommend that you check with your practitioner so that you know if these things are safe for you to do or not. We used to prepare slippery elm tea with a little bit of honey for coughs and sore throats. If you're German, you may remember using something called mustard oil. My mother-in-law talks about that all the time as a kid. It was this stinky, thick salve that you rubbed on your chest, but it made your chest feel better and you could breathe. Somewhat like Vicks these days, but doesn't have such a great smell like Vicks does. But these things helped with cough and chest congestion. Now, the Native American cultures also used to use hot peppers. When you eat peppers, you clear out your sinuses, easier to breathe. And garlic, of course, because it's a natural antimicrobial. We can also use something like mullein leaves, which is used for lung problems. People used to smoke mullein back in the day, but they can also be soaked and made into a tea. And that helps a lot with our lung inflammation. Herba manza is a spicy, has a very strong spicy odor, but if it's boiled, it's used to reduce muscle aches and pains. So today we use things like Advil or Aleve or Tylenol, but some people can't use those things. And these herbs are things that are alternatives for some people. Even using something as benign as eucalyptus oil, it can be put into a diffuser or a humidifier to help with cough and sore throat and flu. And it can also be put in the bottom of the shower, and then you hop in the shower and the steam from the shower allows you to breathe that in better. And so these are really great tips that we can do and we can use. I think we've forgotten our old-fashioned remedies that have been passed down for centuries to care for ourselves. And what I would like to recommend is you to have on hand certain things when someone in your family gets sick. Some of these things that we just talked about are great to have on hand. Other things are vitamin C, vitamin D, NAC, zinc, quercetin, glutathione, aspirin, ivermectin, HCQ, nattokinase. All of these things to have on hand are really good to have. If you're someone who gets sick and it almost always goes to your lungs and you're having problems with bronchitis or easily get pneumonia, having some prednisone on hand is always a good thing as well. And so preparing and having things on hand make us not so afraid when we get sick, because who's going to run out and find all these things for us if we're sick? We shouldn't be going out, but sometimes we don't have a loved one that can go out or knows where to find things. And unfortunately, sometimes we go to the local store to find these things and they're out of stock. So having them on hand is really good. You know, with any viral infection, it could lead to a bacterial infection. So having an antibiotic on hand is important, especially if you're prone to bronchitis, like I had said earlier. Now, for decades, we've known about something called postviral illness. It's very common when people have been sick with a viral infection. We've seen it a lot in people who've had mono. Also, the herpes family virus, we see it happen a lot after that. And now with our most recent illnesses that we talk about every single day that I'm not going to talk about because this will get taken down if we do, it's very hard. People who have high viral loads, like in mono, can develop elevated cytokines, and cytokines are just basically inflammatory markers. And these inflammatory markers can cause all kinds of symptoms like headache or muscle pain, fatigue, brain fog, moodiness, shortness of breath, nasal congestion, pretty much any symptom. And we've been working with chronic Epstein-Barr patients for a lot of years and have seen this happen quite often in them. You'll oftentimes hear people say, gosh, since I've had mono, I've never been the same. I've always fatigued. I always feel like I'm coming down with something, but it never quite fully develops into anything, but it doesn't ever completely go away either. And sometimes that can happen because of these elevated cytokines, and they create this inflammatory response throughout the body. And depending on which cytokines are elevated, kind of depends on what symptoms that you're going to get and how long those symptoms might last. But it's really important to work with someone who has a integrative approach that can help you identify these things and bring them down, because if you don't, they can continue to create other diseases and other problems for you. The root of all disease is inflammation. So you want to make sure that these things are kept in check. One of the other big things that we're starting to see with many patients is this post-viral clotting issue. It's not happening with the disease or the illness itself. It's happening post, thingy in the arm here, which I'm not going to say because again, we'll get taken down. So what we've been seeing is people who have experienced this in their arm, they are having a lot of issues with clotting. So what we're seeing is people, specifically people who have been given this in the spring. So March, April patients we're seeing now, they are having elevated D-dimers, troponins, and low CD57 counts. Well, why these things? It's been my experience of what we're seeing is these elevated clotting numbers like the D-dimer. And these elevated D-dimer levels tell us that there's microvessel clotting happening in the body. We may not be able to identify where it's happening, but we know it's happening somewhere. I've had patients reach out to me and say, hey, my D-dimer is 0.96. Is this normal? My doctor's saying it's not high enough to worry about. Well, The normal level for a D-dimer is less than 0.50. So when you're at almost 1, that's a significant rise for us. We would be concerned because in our world, we're all about prevention. We don't want to wait until somebody develops a clot or has a stroke or an aneurysm or a heart attack or anything like that. We want to intervene before that happens. And so elevated D-dimer levels, in our opinion, should be treated. And people need to be evaluated to find out where that clotting is happening, if possible. Now, we're also seeing young people in their 20s with high troponin levels. Troponin is a test that we do to look at the heart muscle. If people have an elevated troponin level, that means they're having heart muscle damage occurring. They need to be evaluated for myocarditis or other heart inflammatory conditions. We're seeing low CD57 counts. So those are immune markers. And typically, if somebody has a chronic illness, their CD57 counts may start to decline, but we're starting to see people with very significant declines in their CD57 counts, so much to the point where they look like they're an HIV patient, which is very scary. Because if their immune system and immune markers are that low, they can't fight off illness. They can't fight off bacterial infections or viral infections or other illnesses. How is their body going to survive things like that? So we really believe that treatment for these things is necessary to prevent further illnesses and diseases. But unfortunately, many doctors are blowing people off and saying, well, those numbers aren't high enough. Don't worry about it. We're not going to intervene with this at this point. And again, I know I repeated this because I think it's important, because seriously, we need to be looking at prevention. How high do numbers have to get before we're going to intervene and provide treatment? I would encourage anybody that if you're getting these tests done or your doctor won't do them for you, find a provider that will. Find a provider that will listen and they'll treat with you before something seriously goes wrong with your health. It is your health, and you need to be in control, and you need to be able to work with somebody that's going to listen to you and believe you and support you and help you. So with the new year upon us tonight, I want to help prepare people to protect themselves. That's why I'm doing this video. We all make wonderful New Year's resolutions. We're going to get in shape. We're going to eat healthier. We're going to go to the gym. But really, what about learning how to protect yourself? What about truly healing wounds from family and friends that have been pulled away from us or divided in these last 2 years? What about making resolutions to teach your family about health, not only what we do to or for ourselves, but what we put inside of ourselves as well? You know, what about developing a healthy mind? Don't just get moving this year, get educated this year. Learn about healing and growing your own food. Learn about being self-sufficient. Ask your family about traditions they've used to heal from sickness when they were young. And then stock up on things in case you need them. And last, find a practitioner who thinks like you in 2022. As we embark on this journey, you want a partner in your healthcare, not a dictator in your health. Find someone that you can be open with and who will listen to you. That's what my goal for you is in 2022. I really want you guys to be able to find something like this for you. So God bless, be well, and I'm wishing all of you an amazing and safe 2022.